One of the challenges, I think, of a diagnosis is balancing the impact of the diagnosis and treatment with the rest of your life.
Teenagers are young adults, and we have to give them an opportunity to be independent and express their feelings independently also.
It's a time of exploration, and then you have this other piece that's sort of saying we have to sort of make sure you follow these certain guidelines in terms of how often you have to go to the hospital, and what kind of medications you have to go, and what you have to do to sort of maintain your health.
It was a challenge trying to adjust to the way things had been before and the way they're now.
Sometimes I'd want to, I would just have a lot of cravings, so then I gained a lot of weight, and then then there'd be a time period where I lost it.
Some days you just don't feel like eating. Like some days I would only eat breakfast and lunch. And Mom would be like, "Aren't you hungry?" And I'd be like, "No." And then other days, like I would just be able to like eat and like feel like I'm not ever gonna be full.
Some of my friends would say, smoothies because they're supposed to be healthy and keep up your energy. So my friends would come up with like big jugs of like homemade smoothies and like in a cooler, and they'd drink them like the entire Saturday. We just sit there and like chill and everything. So it was pretty awesome.
We spend a lot of time thinking about nutritional support.
So we ask, most importantly, that you eat a healthy, normal, balanced diet.
So the other piece about being a teenager is that it's also a time of exploration, of sort of learning about the world and the different values and beliefs and options and opportunities.
It's totally expected. That's the time of your life when you're supposed to be trying new things. Some of those things may be things you want to discuss with your parents, and other things are things you may not want to discuss with your parents.
Whenever you're thinking about sort of trying or exploring, I would certainly talk to your medical team.
It is very difficult to go through cancer treatment as it is.
It's important that we are used to having conversations about that with our the patients that are teenagers. And that it's important that if you're considering exploring anything like that may have an impact on your body or your health, so that could be tattooing or piercing or any kind of drug use, including alcohol, that I would talk about that with your nurse or doctor about how that could impact the medications that you're already on for your cancer treatment.
I used to do figure skating, and it was really hard for me to adjust to the fact that I can't skate and run when I used to do baseball, but I don't know, I've sort of adjusted, and I learned archery, and I do swimming now, and it's like I've become really into that. So it's kind of just figuring out what works for you with the limitations I have, and I've gotten used to it, and I'm just fine.